Hello everyone and welcome to another episode of Retina Roundup. I am Dr. Ushma Vora Satija, Fellow in Vitro Retina and Ocular Oncology, and I am bringing you this month's top 5 articles. The first article we are focusing on today is on the impact of using dexamethasone eye drops in the treatment of retinopathy of prematurity based on a retrospective analysis. This report highlighted that 24% of the 48 babies with type 2 ROP, when treated with dexamethasone eye drops, did not require laser ablation, in contrast to 74% of the babies who were not treated with dexamethasone eye drops, thereby indicating a positive impact of dexamethasone eye drops in halting the progression of type 2 ROP. Our second study aims at assessing the impact of intravitreal bevacizumab on the long-term cognitive outcomes in children with retinopathy of prematurity. In this study, the babies were enrolled into 5 groups. First was premature babies without ROP. Second was ROP not requiring any treatment. Third, babies were receiving intravitreal bevacizumab monotherapy. Fourth was babies requiring combined treatment, that is intravitreal bevacizumab with laser therapy. And the last group was babies receiving only laser therapy. This study concludes the presence of severe cognitive impairment at baseline in the babies falling in the combined therapy group, that is both intravitreal bevacizumab with laser therapy, although the cognitive outcomes at 6 years of age were comparable among all groups. Our third study is a cohort aimed at establishing an early biomarker for detection of AMD by jointly analyzing OCT, health records, and genomic data to time the sequence of changes in retinal thickness layer in patients with AMD. The study concluded the presence of photoreceptor thinning much prior to the presence of RPE with Bruch's membrane thickness in patients with AMD. Photoreceptor thinning was present throughout the life of the patients and also had a positive correlation with CFH and ARMS gene, thereby proving it to be an early stage biomarker in patients with AMD. Our fourth study aimed at investigating the impact of blocking ocular sympathetic activity, both surgically and pharmacologically, on CNV progression in a rat model. In part 1 of the study, the rats with laser-induced CNV were divided into 4 groups, and first group was treated with artificial tear drops, which was the control group. Second was treated with the beta receptor agonist isoproterenol drops. Third was treated with beta receptor antagonist propranolol eye drops. And fourth, with internal carotid nerve transection 6 weeks prior to the laser-induced CNV. In the second part of the study, rats with laser-induced CNV underwent internal carotid nerve transection at different time points after the laser injury. The first part of the study concludes 75% of reduction in CNV volume by pharmacological block of sympathetic activity, whereas the second study concludes complete inhibition of progression of CNV by surgical sympathetic block of internal carotid nerve activity, regardless of the timeline. Thus, electric block of internal carotid nerve activity could be a potential bioelectronic medicine for treating wet ARMD. Our final study, number 5, aims at assessing the impact of prophylactic ranibizumab to prevent the development of neovascular AMD in eyes with intermediate AMD for patients with pre-existing neovascular AMD in the contralateral eye. In this multi-center randomized control trial, patients were treated with intravitreal ranibizumab 0.3 mg every 3 months for 24 months versus sham injection. This study quoted the same conversion rate of 13% to neovascular AMD in both groups, thereby concluding that quarterly dosing of 0.3 mg ranibizumab in eyes with intermediate AMD did not reduce the incidence of neovascular AMD and had no impact on the final visual activity at 24 months either. So that's all for this month. See you next month with 5 new articles. Bye-bye.